Good afternoon, everyone. Thank you so much for joining us today in this conversation about how to help students and fellow Jayhawks through this time of crisis. I am Heidi Garcia, Associate Director of Watkins Health Services, and I welcome you to the presentation. There is a panel of experts from Watkins Health Services, Counseling and Psychological Services, and Student Affairs here to provide important information and address questions that were submitted prior to the presentation. You can submit additional questions through the Q&A function at the bottom of your screen, and answers will be posted on these departments' websites along with the presentation. I'd like to take a moment to introduce the panelists. Joining from Watkins Health Services is Dr. Pavika Saripalli, Chief of Staff, and Jenny McKee, Health Education Program Manager. Joining from Counseling and Psychological Services is Dr. Eric Atwood, Psychiatrist, and Heather Frost, Assistant Director and Licensed Psychologist. And joining from Student Affairs is Rachel Auten, Director of Student Support and Case Management and Licensed Master Social Worker. We will begin today with Counseling and Psychological Services. Heather Frost and Dr. Eric Atwood will address best practices in approaching students of concern without crossing legal and confidentiality lines, availability of bilingual clinicians, information about how to best support students, and services currently available for students. At this time, I will turn it over to Heather, followed by Dr. Atwood.
And here I am. Hello, everyone, and thank you for coming. I'm going to start actually by giving you advance warning that if I get disconnected mid-sentence, which did happen to me when I participated in a panel a couple of weeks ago, please move on and I'll return as soon as I can. If I'm able to return. So anyway, with that caveat, that was the one and only time I got thrown out of Zoom, but it could happen again. I'd like to talk about services first that are available currently to CAPS. Let you all know that Counseling and Psychological Services is still here. Our entire office is working remotely. We are offering services by phone only at this time. So that includes individual therapy with pre-existing clients that we had prior to the pandemic, and also we are taking new clients. We are not doing group therapy at this time. We did have to suspend that service for the moment. We are providing psychiatric services for ongoing clients only, so not first-time or new appointments. We are happy to facilitate referrals. If students are local, we do have the Burt Nash Community Mental Health Center and other local options that are available. We can also assist with referrals for students to mental health services. If these students have moved back home and are no longer residing in the state of Kansas, in that case, we're not able to continue working with them as we're not able to practice across state lines. One exception to that is the state of Missouri. They have allowed us to do that, and we're looking into whether or not there may be exemptions or exceptions for other states as well. We have drop-in presentations available online via Zoom, and those can be attended by not just students, but also faculty and staff. I encourage you to look at our website for the schedule each week. But for example, right now we have sessions on guided meditation, one about cultivating resilience, one on behavioral activation, or what would be known as motivation. I think she's titled that, How to Do the Thing You Don't Want to Do. I intend to look in on that one actually, so that could be useful for any of us, I think. And I would encourage you to, we don't have time to really go over our entire website, but we've been updating that constantly. I would encourage you to peruse the CAPS website for all kinds of information and resources about coping strategies, tips even for teaching online, all kinds of resources and links that we have available to you. We welcome you to call to consult any of us about concerns that you might have about students. So, but also know that we may wind up referring you to the SCRT. I know that Rachel Auten in a few minutes will be talking about what that team does. That's the Student Care Referral Team. And I will highlight the one distinction, because I do take many calls over the course of any given year or semester from faculty and staff who are legitimately concerned about a student. One distinction between what CAPS staff can do and what the SCRT does is that it's within their purview to initiate contact with the student. So if you contact me and we talk and I say, yes, you do have a legitimate concern, I may very well wind up encouraging you to call the SCRT or to file a report with them, as they can initiate contact and reach out to a student that you're concerned about. And I also, in terms of other resources and services, want you to know about the KU Psychological Clinic, which is currently usually located in Fraser Hall and run by the Department of Psychology. They shut down for a period of time, but as of May 1st, they are back up and running and taking new clients. They are seeing people online as well, and need you to know that they're also available to non-students as well. So for faculty, staff, your family, your friends, they don't just have to see students there. That's it about services that are currently available. In terms of a question that came to us about what's available with regard to bilingual clinicians at CAPS or elsewhere. At CAPS, we have 3 clinicians who are bilingual in Spanish. And on campus, another resource that's available is called the KU International Students Research and Service Center. Again, the KU International Students Research and Service Center. It's run in the School of Education by Dr. Chang-Ming Duan. And they can be contacted by email. They do not have a phone number or a website for you to look at, but it is kuiprc@ku.edu. If you're writing this down, kuiprc@ku.edu. They're providing not therapy services, but individual consultation and support groups, again, for international students. They do not charge for their services, and they're able to provide services in Mandarin and Spanish as well as English. The question that came in about best practices in approaching students of concern without crossing legal and confidentiality lines, and part of that question was whether or not any of this would change due to the current situation that we're in. The current situation, i.e. the pandemic, doesn't change any reporting requirements that faculty and staff would have if you are told situations of discrimination or sexual harassment or sexual violence. And I would refer you back to the online training that we all required to take for information about how to have those conversations with students. So bottom line, you're not able to guarantee confidentiality for any conversations that you have. And the legal aspects, honestly, I don't know who asked that question, a little confused about what more you're wanting about that. So please feel free to ask another question or to contact anybody at CAPS directly to continue that conversation about the legality. And one more thing I want to do before my time is up, I'm going to ask you to all please indulge me, and I'm assuming you have your cell phones handy. Please take out your cell phone, and I want you to add a phone number to your contact list. I'm going to give you a moment to get your phone or to get a piece of paper so that you can write this down. The resource is an important one. It is the National Suicide Prevention Lifeline. Again, the National Suicide Prevention Lifeline, or NSPL, and that number is 800-273-8255. Again, 800-273-8255. I ask you to add that to your contact list. My fantasy, honestly, is that everybody at KU, everybody in the country will have that phone number at their fingertips, available for themselves, for anybody that they care about, certainly for students that we come in contact with, but also our family and friends. And although it has suicide in the title, I just want to stress that it is really a phone number that's available 24/7 for any kind of emotional distress, not just people thinking about suicide. Here in town, headquarters, which is our local agency, is actually one of about, I think, 160 centers nationwide where those calls will come in. And for those of you who are listening right now who are faculty, I want to ask you to help all of us reduce the stigma about mental health issues. So one thing that you can do is to please include this phone number on your syllabus. And on the first day of class, ask your students, just as I asked you to do just now, to take out their cell phone and to add this to their contact list. I think that would go a long way to helping, just acknowledging that there are mental health issues and crises and distress that people may be dealing with, either the students themselves or someone in their lives that they care about. So again, National Suicide Prevention Lifeline, 800-273-8255. And that's all I have. Thank you so much.
Dr. Atwood, are you there?
Yes, I am.
I will pass the torch to you.
All right, thanks. I didn't know if you were coming back on. Thank you.
Thank you.
Thanks everybody for joining today. It looks like a good turnout, and that's very reassuring to hear, to see. I'm going to quickly cover just a couple of areas. One is the idea is to give a broad view of what our college students are dealing with as they go through this pandemic. And I'm going to look at a national survey that looked at students across the country, and then talk a little more specifically about some of the concerns that are raised by KU students in their work through CAPS. Because this is a lot of information coming at you quickly, I can cut to the bottom line of what this message is about very quickly, and it's very simple. And that is to focus on being as flexible, as kind, as empathic, and supportive as you can possibly be in all of your interactions with students. We're finding that there is a considerable vulnerability that often isn't apparent through casual interaction, and that students are really being affected by this. And it's important that we give all the caring messages that we can to let them know that we're valuing them and we're concerned about them as people and their reaction to this crisis even more than we are their academics. The first study that I'll talk about is the Active Minds survey that looked at just a variety of issues, and to no one's surprise, 80% indicated that they had negative impact on their mental health related to all of this. Issues, and 20% indicated at least a significant drop in mental health or deterioration. Issues ranged from very high numbers of stress and anxiety to sadness, disappointment related to all the losses and changes associated with this. An interesting point to make that we'll come back to in a little bit is almost 50% indicated significant issues surrounding stress associated with financial loss and strain, whether that be their personal loss and difficulties, or that related to their family and its impact on them. So just to highlight that there's a number of issues, including the financial piece, that are having a major impact. This is obviously occurring at a time in young adult development, kind of a crucial, vulnerable time. And it's going to have an impact, a lasting impact for quite a while to come. The question then, what did the students indicate that they want or need from us in providing help or support? Number one, regular, clear, compassionate communication regarding academic options. What can they do? What should they do? How can they get through this and survive and not be hurt academically? And also communication around mental health resources. Around 50% indicated that they didn't know where they would turn if they had an acute need for a mental health service for themselves or a friend, which is kind of alarming. And hopefully that number would be lower at KU, but perhaps not. They may have their best option of hearing about something from a faculty member who's talking to them about a specific concern. They're looking for academic support, flexibility, leniency, accommodations. You know, that can take a whole lot of forms in this new world of online remote learning. And I'm sure that our faculty have worked very hard to find that right balance. I can just make the point that the reason flexibility and accommodations are so important is students are struggling. They're struggling more than might meets the eye. And one of the biggest concerns from students around the country as well as here is their focus, their motivation, their time management, their ability to initiate is really down. And I think there's a host of reasons that we don't have time to cover completely today, but there's lots of issues going on. And even our scholars, people that I've worked with that are just superb students, are struggling in this regard, and so you can imagine those who were struggling before, what this may be like for them. And it's really a major obstacle. They want increased mental health resources. They want empathic communication and validation. And they also ask that there be long-term planning at the university level that helps with the healing and recovery from all of this when they are back on campus, and that protocols are put into place so that if we have a similar crisis in the future, we're able to pivot to remote learning as smoothly as possible. Again, in terms of the KU students and the issues that I'm hearing and my colleagues are hearing at CAPS, you know, I think we've all been impressed by some of the environmental concerns that our students are dealing with. Many have returned home, as you know, and home may not be a particularly conducive place for studying, for privacy, for any kind of confidential conversation. It may not be well suited technologically for Wi-Fi and the needs of remote learning. And there may be expectations that students fall back into when they're back home that are further distractions, such as, you know, helping with chores around the house, teaching younger siblings who are being homeschooled, even getting jobs to help with the financial impact that may be happening if a parent or two have lost their jobs. There's certainly issues that students have around health, their own and their family. Very worried about parents or grandparents, particularly family members who are not social distancing or adhering to the same protocols that the student may be. They just feel more vulnerable and they don't feel like they have the control that they would like to have to manage the situation. The financial issues that I mentioned earlier, it's very common, and it hits the lower socioeconomic students and families harder, and they are reluctant often to ask for help when the need is there. Heather and I wanted to make sure people are aware of the help.ku.edu component of the university website that consolidates all the information around financial assistance, and that's true for faculty as well as students, and to pass that information on to students who may be struggling or you suspect are struggling with financial issues. Academic issues that have been brought up to our providers, and this is not at all a indictment of any faculty member or indication that change has to happen. It's an indication that you should know how perception students are perceiving and reacting to the various changes that have occurred. You know, it includes everything from just changes to syllabus to accommodate the changes, you know, things that are not expected and now being handled remotely. Students may not feel like they have adequate access to faculty to discuss or deal with problems or ask for accommodations, making as much time available as possible for students in office hours and other times. Bringing up even mental health issues and asking how people are doing, you know, sharing your own experience with students so that they know we truly are all in this together and having similar experiences. Some students have commented on, you know, there's been a change to doing quizzes timed quizzes online because to reduce chance of cheating. And that could be an anxiety-provoking situation for anybody, but for people with anxiety or panic attacks, it is definitely not the ideal way to get the knowledge that they have out on an exam, and to be sensitive to that. There are many, many students, anxiety is the most common thing that we treat on campus, and to be sensitive that some of those approaches may be very difficult. You know, my time is over here. I want to just say that remember the flexibility, kindness, sympathy, and support. And I want to close with just a quote that came from one of my colleagues, and I would credit that person if I knew who it was. But let me share it with you as we end. We are operating in the midst of a global trauma, and our hierarchy of needs is being toppled over. Let's just be nice to each other and start from a place of understanding and compassion. It's not a normal semester, and acting like it is or could be is just not in touch with most people's realities, especially people who are typically in precarious economic and social positions, such as students. Thank you very much.
Thank you so much, Heather and Dr. Atwood, for that information. Next, we will hear from Student Affairs. Rachel Auten will address what the Case Management Office does, how to provide outreach and follow-up with students, and available campus and community resources. So Rachel, please take it away.
Thanks, Heidi. Hello, everyone. My spring allergies are in full force, so that's why I sound like I do. But thank you for having me on to talk about the ways that we can support our students in this difficult time. So thank you also to Dr. Atwood and Dr. Frost. I think you set a really good groundwork for what Student Affairs does, and specifically what my office does to support our students, and in turn, how our faculty and staff on campus can use my office of case management to get that help to students. So first, though, I'll start with our student care referral team. So Dr. Frost talked about this a little bit, but our student care referral team is essentially our threat assessment team on campus. So it's made up of 9 members of our KU community, and we assess threat when students are either posing a safety risk to themselves or to others. And so you can refer students to this team through Student Affairs really at any time. We're not an emergency service. We certainly, if a student is at immediate safety risk, we encourage you to call KUPSO or 911, but we serve as the team that kind of evaluates the risk over time and gets students connected to supports that are available both on campus and in the community. So all that to say, if you have a concern that a student is maybe a safety risk to themselves in terms of self-harm or suicide, or would pose a bigger risk to the community around them, we certainly are a team that would want that information. Case management is a step down from the SCRT team. So student support and case management is made up of myself and then 2 other case managers, Sarah Chavez and MJ Sellers. And the 3 of us work together as a team to provide case management support to our students. So like Dr. Atwood was talking about, our students right now are facing all sorts of barriers to their academic success. So they could be dealing with extreme financial crisis situations. They could be in an unsafe living situation, or their family is taking up a lot of their time and energy, and they're providing care to elderly members or younger members of their family. Any of those things could be happening and affecting their mental health, their academics, and just their overall well-being. So the case management team really exists to parcel out what those barriers are and have a conversation with students about what's leading them to not be successful, not just in their academics, but in all areas of their life. So we provide those individual meetings to students to figure out what their needs are according to them, and then figure out a plan of action to support them. So that could look like connecting with their academic advisor, connecting with CAPS, connecting with other community agencies, and just really having that individualized care to help them outreach those supports and get connected to them, and then solve, or at least start addressing those barriers that are in place. So case management exists, I like to say, as a resource where if a student is facing a multitude of barriers, where a simple referral to CAPS or to their financial aid counselor won't necessarily solve all that's going on, or if the student is not in a place to make that connection themselves, if they need someone to help empower them and work with them, that's where a case manager can step in and offer that individualized support. So to access both SCRT and the case management team, you can submit a care referral through the Student Affairs website. So that's just studentaffairs.ku.edu. And when you get to that landing page, there's a button in the right-hand corner that says concerned about a student. And then that will take you to the form to submit that referral. And once you submit that referral, it goes to SCRT. We evaluate what the threat level is, and then it can get passed down to case management if it's not that highest level concern. So that referral system works really well, but if you ever have questions or don't know if it's right for a care referral, you can certainly email the case management office at studentsupport@ku.edu or call us at Student Affairs 785-864-4060, and we'll just talk through that. But I think we're seeing a lot of referrals of students just not engaging in their online work, or they have reached out to faculty or staff and let someone know that they're struggling. And then, so we exist, my office exists as a support to you as faculty and staff to make that referral and not have all of that knowledge on your own and feel like that you're getting overwhelmed with all of the students who are coming to you and expressing that need. Sarah on our team also oversees our emergency fund. So as Dr. Atwood said, that help.ku.edu is part of our emergency aid network. So we're seeing, of course, a lot of financial need right now. So if students have a financial need, you can direct them to the emergency aid network, where they can fill out an application to either get connected to our funds or some of the federal funds that have opened up. One of our funds managers will connect with them and help with that support. As far as community resources, Burt Nash is our community mental health center, which is a great resource if a student is really struggling and needs more care than CAPS can provide. Dr. Frost already mentioned the National Suicide Prevention Lifeline, which is an amazing resource, but we also have headquarters here, Headquarters Counseling Center, which answers the local NSPL number. So just a great resource as well to give to students, because again, they can talk to students about anything that's going on. They're also a 24/7 free and confidential phone service. So it's not just if a student is struggling with immediate suicidal thoughts, but just if they're overwhelmed, if they need help figuring out an emotional situation, anything like that. I think that's all I have. I ran through it really, really quickly, but just know we understand that it can be very overwhelming as faculty and staff to have information that students are struggling, and that can be set you up for some of that vicarious trauma and just feeling overwhelmed yourself. So our offices exist to help support you in that journey to get students their own support. And if you ever have questions or concerns, feel free to reach out to Student Affairs. We're definitely here to support you as well.
Thank you so much, Rachel. That was great information. Now we're going to hear from Watkins Health Services. Dr. Pavika Saripalli and Jenny McKee will address COVID-19 testing, medical services currently available for students, and tips for self-care and how to avoid defaulting to those not so good habits as a way to cope. Dr. Saripalli will begin, followed by Jenny.
Hello, good afternoon. I just want to thank the previous presenters. That was wonderful information, and hopefully we'll be able to reach out to a lot more students and connect them to the resources they need. I'm going to start by addressing the issue of testing. It's something I get asked about probably multiple times a day. Should I be tested? Is it time for me to be tested? What do I do with the results of my testing? And it's a topic which is really evolving rapidly. At this point in time, the public health system is not requiring or recommending that everybody seek testing for COVID. There may come a time when they do that, and whenever our public health authorities address us and ask us to do that, we're happy to help with that mission. At this point, there are a variety of testing types available, and it's different than a normal test situation because we have these emergency use authorization category tests, which means they don't do harm. We know that they are somewhat accurate, but they have not gone through the extensive vetting process that a lab test in the US normally would go through. What that means is we're not as confident or able to predict how accurate that test will be for you as an individual. The first test that we acquired locally was the nasopharyngeal or throat swab to look for the presence of virus in your throat. We are actively collecting specimens for that test, and we can run them through the local LabCorp or Quest labs. We can also collect for the public health CDC KDHE system, but there are more stringent criteria. In order to have your system processed by the public health system, you need to meet some very strict criteria and be fairly seriously ill or have close contact with somebody who is a confirmed COVID case. What that means is if you approach us for testing, we're probably going to have to use LabCorp or Quest because most of the people that come to Watkins are not really sure that they've been exposed. There's a possibility they don't feel well, they know maybe they've traveled, but they don't meet that strict criteria that would enable them to use the testing platform. Having said that, though, we're happy to collect your specimen, and we understand that information is very important to you. Right now, we're being advised by the public health officials not to test asymptomatic people. They generally feel that the accuracy of the testing goes down when a person has no symptoms. There are special situations where you may be advised to test even in the absence of symptoms. Situations like you're a known contact to a positive case, you perhaps are in a very high-risk environment like a closed facility, such as a nursing home or a prison where there's a known outbreak going on. We do have students with family members who are on chemotherapy or have other immunosuppressing situations, and they've been asked by their family member's doctor to get a test before re-entering the home, and we're happy to help with that. So I would say if you're on the fence and you're not sure if you need testing, call us and we'll walk through it with you. We want to be an avenue of care to provide access to care. We don't want to be a barrier. The main thing is we don't want you to have a test that doesn't mean anything. And so it's important to sort that out together. There are other tests called point of care tests where the testing is done right there on site. Right now, the CDC is not clearly recommending any one of those in particular. We have reached out to local lab authorities to try to see if there's an accurate one that we could use in our facility. And right now, the best testing that's available is in very short supply. And we've not been able to purchase a system like that for Watkins. So we apologize at not having a rapid test. But right now, the only rapid testing that we could procure for you would be something we wouldn't have a lot of faith in. So it didn't make sense to get that at this time. We're actively pursuing that for fall or perhaps late summer. The last category of testing that's currently available is a blood test for antibodies. Again, it's a hot topic. Nobody's sure what these antibodies mean. Generally, you have to have been exposed or had the illness 6 weeks ago or longer to have a positive test. So some folk are in a panic and they say, I don't feel well, I want that blood test. If you don't feel well now, it's the throat test you want. The blood test is not necessarily going to answer your question. The other issue with the antibody test is having an antibody does not mean that you are immune or protected or contagious. To be honest, we don't know what it means. The CDC and the NIH are crafting a nationwide study to sample a very large measure of the population, different groups as well, students, educators, healthcare workers, nursing home residents, trying to get a sense of how many people in the US have been exposed to COVID. How much more is it than what we think? So it's got a lot of research application. When they understand it better, they'll probably roll it out nationwide. Right now, we're not encouraging the public to get this test. Unless you've been advised by some special group like KDHE or your personal physician, we're not offering this test to the public. If you think it would be beneficial to you and you have questions about it, we're happy to talk to you about it. Give us a call and I'll call you back or arrange to visit with you. I need to move on and speak a little bit about what services Watkins has at this time. Right now, we're slowly trying to get back to all of our normal levels of care. The challenge has been that we need to separate the well from the sick. To this end, we have a screening process at the front door that when you come in for an appointment or a walk-in clinic service, we're going to ask you about the presence of fever, other symptoms, recent travel, or any known contact with people with COVID. This means that the total number of patients we can screen and get through the door is not the same number we normally can when we don't have this process in place. So we encourage you to call. We're actively making appointments for all kinds of services, both preventative, well care, routine care, and acute care. But we don't have the web booking in place simply because we need to screen you before you come in. But you won't be turned away. We'll make sure that we serve your need. And we want you to know that our routine services are available. We're just limited in the number of people we can get through the doors every day. Our goal is week by week to open that up and get more rapid access to care until we're at our full level, which should not take more than a few weeks to reach. Hopefully this answers some of your questions. And as I said, feel free to call. We're happy to walk with you through whatever your issue may be and try to get the service that you need in a timely fashion. Thank you.
Okay, as Heidi said, I am going to be talking about self-care and engaging in the most healthful coping mechanisms that you can, including what it looks like when maybe you backslide or not engage in those most healthful coping mechanisms or your best version of self-care. So just want to start off by saying that self-care is never a luxury. And you probably have been hearing people talk about self-care a lot right now, maybe more than ever, but it's something that we should always be doing for ourselves. During times in crisis or times that are particularly stressful, we find that all of a sudden we need to do this, we need to meet our essential needs, and that's when self-care becomes an even bigger conversation. And if we haven't been practicing it on a regular basis, we can feel like we're behind the 8 ball a little bit. So during this time, you might find that even though you normally care for maybe family members, loved ones, you engage with colleagues, students on a very regular basis, right now you might be doing that in a much larger capacity than ever before. And even if you have a wide bandwidth for chaos typically, atypical times can make this extraordinarily difficult right now. So self-care is always important. If we are experiencing more people needing us right now and we're taking care of them and their needs, and I know this is ironic, but this is when we need to be doing the most self-care, and sometimes it's the most difficult to get around to that. So just know that if you're having a hard time fitting it in, you're not alone. Everyone is experiencing that right now for sure. If you aren't sure what self-care is or what that looks like, just know that it can be different for anyone and everyone. It could be having screen-free hours or even a screen-free day, if you're lucky enough to get to do that. It could be planting a victory garden, moving your body in a way that's comfortable for you, cooking, connecting with nature, if that is something that you're comfortable with right now, practicing mindfulness, engaging in hobbies that maybe you find joy in, really anything. And what it's important for you to remember is that it doesn't have to be the Pinterest version of this or the Instagram influencer version of these things. It just has to be something that you enjoy, that brings you joy, and that takes you away from whatever is clogging up your brain waves for the most part, or things that stress you out, or things that are taking away from what brings you joy in your life. There isn't a necessarily prescription or prescriptive time frame for when you need to be doing these activities. If it works for you to find the exact same time of day every day to do something that brings you joy, by all means, do that. You might find you will have greater success if you get little pockets throughout your day, just a few minutes here and there. I know that I find the best success when I allow for some fluidity and when I get to get my run in or a walk. And on a day where it's raining outside, being flexible and gentle enough with myself to understand that a run's not going to happen today, maybe, and to find something else that's going to bring me joy. I want you to also consider that self-care can look like taking a break from the news or what's going on in the world today. Information is important to have, and it's very readily available, but sometimes just turning our blinders onto just us, what we need, what the people in our house need, and kind of turning off the news, turning off those social media accounts just for a small period of time might give us a surprising respite, help us feel much more restored. Human connections are really difficult right now and very different than you may have experienced them in the past. You might feel a lot less connected to people. I've also talked to folks who've said that they have friends, family members, old acquaintances coming out of the woodwork, wanting to connect now more than ever. Both of those are very extreme ideals. Please try to find a good balance or blend of those for yourself. Some contacts you might be very excited about, while others you will find that are not welcome at all. You might not have emotional space for everyone all the time, and that's okay. When you know that you need to take a break from screens, if you've been doing a lot of this, a lot of watching a screen, you've been talking a lot to people, take time for yourself to not talk to anybody at all if that feels really good. So sometimes when people call, they want to catch up, they want to celebrate something lovely or beautiful in their life. Sometimes they want to vent or talk about things that aren't going well for them. If you don't have the emotional space or capacity to have any kind of conversation, let people know up front that, hey, I love you, I care about you, your relationship means a lot to me, and I don't have time, I don't have space and emotional capacity to have this conversation right now. Can I call you tomorrow? Or can I call you after I get back from my walk? When you do that, it might feel so weird and it might feel cruel or mean, but what you're doing is loving in a couple of ways. First of all, you're loving yourself by making sure that you're not taking more on than you have time or space for in that moment. Also, you are showing love to that person by putting the best version of yourself forward to them when you do have that emotional space. they also might learn in that moment that it's important that we ask someone before we talk to them about something that we need to vent about, or we want to share something with them. You know, checking in with others, especially now when we're communicating about, do you have space for a conversation? I really need to vent right now. Do you have emotional space for some venting? That's another really important self-care thing for conversations and communication. Okay, so let's say that you already know what your self-care routine looks like. You've been practicing it. You are an A+++ self-carer. Here's the thing. We are all human beings, and sometimes we have bad days. Sometimes things, all the time, things happen that are outside of our control, and we stumble and we backslide, and we maybe do things that are outside the realm of healthful self-care, and we end up participating in behaviors that we actually feel guilty about, or they are less healthful for what we need in that moment. The first thing I'm going to ask you to do is, if that happens, to remember that that will happen. Anytime you are working on behavior modification, you change something about the way you move through this world, you may revert back to doing something that is less healthful. That's all right. Forgive yourself in that moment, and know that in the next hour or in the next day, you will try again to practice self-care the way it looks for you. It is especially difficult to self-care on a day-to-day basis, now more than ever. So anticipate that you will have days when you're not going to be doing the best version of your self-care routine, and you certainly aren't going to be participating in life the way you normally would. I have been getting questions about eating as healthy as possible, about weight gain, about maybe using alcohol a little bit more than normal with virtual happy hours that are happening. Those things might and will happen. So know that there's all different kinds of reasons why we aren't able to meet maybe some of our self-care goals right now, and that's okay. We'll get back on track as things start getting more normalized, whatever that looks like and whenever that is going to happen. I'm going to talk a tiny bit about weight gain because I do get a lot of questions about that. It is perfectly normal and natural for a human's body weight to fluctuate throughout their lifetime. As mammals, it is the way our bodies are supposed to respond to add body weight which our body considers energy when we are in state of crisis. So even if you've been eating as healthfully as you can, and you've been getting the kind of physical activity that you normally have, and you've noticed weight gain, there's a reason why. There's also a reason for weight gain. If maybe you're eating foods that you wouldn't normally eat, maybe comfort food, that's okay. That is us being mammals, trying to get good energy stores ready to go. It's part of a fight or flight response, which is really normal and makes a lot of sense during a time of crisis. So just to close, I'd like to remind you all that it is 100% okay to not be okay. There might be days where you're doing really well. There might be days when you feel devastated about what's going on. So just to know that it's okay not to be okay, and that it's important to love yourself and to start new every day about self-care, and know that you can reach out to folks to support you for whatever you need, whether that be loved ones, whether that be colleagues or supervisor here on campus. And you're always more than welcome to reach out to myself or anyone on this panel if you find that you still have more questions, or you just want to talk to someone about another specific issue that you're having. So I'm going to go ahead and turn it back over to Heidi now for the closing.
Thank you so much, Jenny, for those wonderful tips for self-care. I am going to turn it back over just briefly to Dr. Saripalli, as she would like to mention one more thing before we close for the day. So Dr. Saripalli, it's all you.
Thank you. I wanted to mention that telehealth services have been started. We found that a lot of our students had left the area but still needed care. They maybe don't have a primary care doctor anymore where they're from, and they have a chronic health issue that still needs care. We also have found that there are students that stayed local but are really concerned their immune system isn't strong. They don't want to catch COVID. So they want care, but they don't want to leave their home. So we do have Zoom video conferencing capability. We've been using it quite a bit. The demand has been high, but you're more than welcome for a new or existing problem to give us a call. We can set you up with a Zoom visit with the provider of your choice. And it is funny to get used to it. It's not natural at first, but we're finding that people really like it. So don't hesitate if you think that would help you. We're happy to work with you in that fashion. Thank you.
Thank you for that information. And thank you to all of our panelists for providing this valuable information for us today. So this does conclude the presentation. We thank you all again for joining us in this important conversation. We hope that you found this information helpful and useful, but please do not hesitate to contact any of these departments as needed. Again, the presentation will be housed on the Watkins Health Services, Counseling and Psychological Services, and the Student Affairs websites so that others can view at any time. Thank you for all that you do for our students and fellow Jayhawks. Be safe, stay healthy, and take care. Thanks so much and have a great rest of the day.